Tent cities, lengthy lines outside food pantries, and street corners dotted with panhandlers. This is a common sight in many cities across the United States. However, these sights are far less common in Salt Lake City. While homelessness is rampant in many major cities, Salt Lake City seems to have the solutions to the homeless problem dialed in. But is it enough? Is it meaningful? Are the solutions long-term? Do the solutions create a form of reliance and institutionalization among the homeless? Or do the solutions encourage and help one get into a better life situation? Is the model that Salt Lake City uses one that other cities who struggle with homelessness can follow to have a better outcome? In the early 2000s, Salt Lake City struggled with its homeless population and had to figure something out. A policy began in 2005 called the Housing First Project. This project, in an effort with the City of Salt Lake, reduced chronic homelessness by 91% in 2014. This program was considered a model for reducing homelessness throughout the country. However, program funding dried up due to rising land costs and housing costs, the stagnant wage growth, and the nationwide opioid epidemic. Because the number of homeless people nearly doubled between 2016 and 2019, local businesses and residents became concerned due to the increased crime and drug use in the downtown area. Salt Lake City launched Operation Rio Grande in 2017 to help root out crime and drugs. Operation Rio Grande was the codename given to a massive multi-agency collaboration to promote public safety in the Rio Grande neighborhood, where the majority of the downtown homeless population congregated. It consisted of 3 phases. Phase 1 was rolled out in August of 2017, which targeted enforcement of the laws. Phase 2 was rolled out for the rehabilitation of offenders who were arrested in Phase 1. And Phase 3 was implemented to help find jobs for all of the rehabilitated offenders. During the 2-year program, it cost the city an estimated $67 million. Was this money used in the most ethical way, or could it have been used in a more effective way to help the homeless issue? To find out, we went to the streets to ask, is Salt Lake City doing the most it can ethically to help the homeless and the number of challenges they face?
All right, well, Janelle, thanks for chatting with us today. So when we walked past you, you had mentioned that you had been homeless for about 1.5 years. Mm-hmm. Can you tell us what circumstances put you in this position to where you are on the streets?
Yes, I came back to save my son's house in Magna, and it went into foreclosure, and we paid and paid and paid, and then he lost his house. So I ended up on the streets.
Is Salt Lake City a friendly city to the homeless?
Yes, it's very friendly. They give us clothes, they give us lotion, shampoos, toiletries, they have wheelchairs, they have asthma machines, they have great doctors and hospitals, they have everything we need.
Janelle helped address some of the physical needs. However, we wanted to delve deeper into the ethical implications of mental health that is prevalent within the homeless community. Meet Nancy, a homeless person who we met near the shelter and who was willing to help answer some of those ethical questions.
How did you become homeless, or how did you become living in the homeless shelter?
I have been chronically homeless for the past 10 years in New Jersey before I moved out here. When I did move out here in November of 2016.
So what resources are available to you to talk about things on your mind? So if you're struggling maybe mentally and having a rough day, right? I know depression's prevalent, not just for the homeless, but for a lot of people through Utah and through the country. What resources do you have in your situation?
Well, there are several staff members that are great that, if you say, look, I really need to talk, they will pull you aside, even security guards. The 4th Street Clinic has a therapy department, and there's several, Valley Mental Health and stuff like that. There really is quite a bit available.
Okay.
So.
Yeah, I know a couple people.
Right.
But,
that's the hardest thing. The other thing is there is really sick, mentally ill people here, and I don't see people, the staff really isn't qualified to deal with them, and they just kind of meander and wander the halls up and down, talking to themselves and stuff. Mm-hmm. I don't think anybody reaches out. Do you have your meds? Do you need assistance getting your meds?
Oh, okay.
So I really would like to see more in the way of getting assistance for the profoundly mentally ill clients here. I just think that's kind of overlooked. They just kind of tread water. They exist, and that's not acceptable.
Yeah.
We then spoke to Dr. Catherine Gibson, a member of the healthcare community, to get a perspective of mental health and homelessness and if the resources are actually making a difference.
So, my name is Catherine Gibson. I'm a family medicine physician. I'm currently the director of health and wellness at ARUP Laboratories and also an adjunct faculty member with the Department of Family and Preventive Medicine at the University of Utah.
What barriers do you see of them getting the help they need, the health care they need?
So I think when you cut it down to the essential elements of what it takes to live every day, we need safety and security as a fundamental component of that. I think if we're in a situation where we're fearful for our everyday situation, where are we getting food, where are we getting shelter, are we safe in the environment we're in, that puts our brain in a survival mode. And I think we don't think very clearly when we're in survival mode, and we also don't think about long-term goals. It's day to day. So your question was like, what are the barriers?
Yeah.
It's so challenging to think about the barriers because those are so fundamental right there.
Right.
So if you don't have stable housing, if you don't have consistent access to food, if you don't have a support system and a community around you, like, you could name all of the barriers that come after that, but those are so fundamental. I mean, even from a standpoint of a practicing physician seeing patients who are mostly insured, the barriers to getting good healthcare are still tremendous. And so when I take that back and look at how complicated it is to get healthcare, with a perspective of not having those basic human needs of food and shelter and safety, it's a little bit overwhelming and mind-boggling.
Well, and I just wanted to touch on, you mentioned that during your residency and then working at the clinic on 4th and 4th, what sort of mental conditions did you see working with the homeless population, and what were some of the biggest barriers?
I think, prior to working at the 4th Street Clinic, I hadn't had much exposure to the homeless population, and so I think to some extent you categorize the homeless population,
Right.
and when you start working with people that lack consistent shelter, you realize, well, they're just like everyone else.
People,
And
yeah.
as far as mental health conditions, those conditions are just like we have in the regular community. It's just that the homeless population has a higher rate.
Absolutely. So do you think that most people, and you kind of touched on it with Luke, and do you think it was a decision or just an environmental factor that led to them being homeless?
That's interesting because we all make so many decisions, thousands of decisions every day, and we're influenced by our environment to the extent I don't think we fully appreciate. And so when we ask a question like, is it this or this, I think it really belies the complex nature of homelessness, but humanity and how any of us come to our circumstances.
Of course.
Yeah, and you brought up one of the things that I think is really interesting when you talk about is these factors that may not contribute, but certainly affect the life of a person that is homeless. And one of the things that I was thinking is children, and how have you seen that kind of play out?
I think most parents will do anything they can to help their children survive. And that may mean, for example, in this situation, the woman was asking for some medication, and I was wondering why she was asking for this type of medication, because it didn't make sense in the context of her scenario. But as I asked her a little further, she said, well, honestly, I can sell this medication at the shelter and earn some money so that my daughter can have money for lunch at school. They hadn't applied for the school lunch program yet. And she wasn't going to send her daughter to school without food. And so she was trying to find a way to earn some money. So I think it puts people in situations incredibly challenging situations
Right.
where from the outside, our natural instinct is to judge those actions. And I think we really have to pull back and understand where those actions are coming from.
Yeah.
What do you think the city has done in Salt Lake to help the homeless, and what could we do more of to help people?
I think when you look at the studies that have been done, which are challenging to do, but most of them agree that having low-income housing available, in other words, providing housing first, is a critical step in helping this spiral go upward instead of down. So in a healthcare environment, if you can provide stable housing and support those within that housing structure, we know that people are more likely to come out of their homeless situation. If we just provide medical care without having stable housing, the same doesn't happen. So in order to make our medical care valuable, we need that stable housing piece. So I think when I look around, especially where we are right now, there are big, beautiful housing facilities going up, and I really doubt they're affordable. And so that's concerning to me. I think the need for low-income housing, especially in the downtown area, is tremendously high.
Great. Thank you.
Are the solutions that Salt Lake City implemented for the homeless the most ethical practices for the greatest number of people? While there may be a difference of opinions regarding the homeless, how we take care of them and spend the resources does not change the underlying fact. There will always be homelessness to some degree. Salt Lake City has continually implemented a variety of measures to help the homeless, whether by the Housing First policy, Operation Rio Grande, or in the creation of new homeless shelters across the valley. Each measure has mixed results. However, Salt Lake City has made great strides to combat homelessness compared to a number of other cities across the nation. The ethical implications for the homeless include personal virtues, resource allocation, and caring for the least among us. We as a society have an ethical duty to do all that we can to care for the least among us, as no one is well unless we are all well.